Thank you for joining us today at our November Coast to Coast Prostate Cancer Support Group meeting. The Coast to Coast Support Group is proudly presented by Prostate Cancer Support Canada, an initiative of Prostate Cancer Foundation BC. We're very thankful today to have Dr. Sophie Lebel joining us to talk about the fear of cancer recurrence and to give us some tips for patients and caregivers. Professor Sophie Lebel is a clinical psychologist with a focus on cancer survivorship and psychosocial interventions. She's contributed to the definition and measurement of fear of cancer recurrence and clinical recurrence, validated a blended model of fear of cancer recurrence, and co-developed a cognitive existential group intervention for survivors that has been tested through clinical trials. She is the director of the Interdisciplinary Psychosocial Oncology Research Group and Laboratory, an initiative that brings together researchers, healthcare providers, community partners, and trainees with an interest in helping cancer patients and their loved ones in the Greater Ottawa region. Clinically, Dr. Lebel helps cancer patients and their caregivers with adjustment difficulties throughout the disease trajectory. And without further ado, I'll pass it over to Dr. Lebel, and thank you again for joining us today.
Delighted to have been invited by Prostate Cancer Support Canada to come and talk to you about this. So I geared this presentation for cancer survivors and for their caregivers as well. So I don't know if there are any caregivers around, but if there are, hopefully this talk has also something for you. And today with me, I have one of my graduate students, Jenny Lamarche, was doing her thesis on fear of cancer recurrence and caregivers. So she's here to talk about a service that might be of interest to the women caregivers of cancer patients. So let's get into this, since we are already a little behind. So what is fear of cancer recurrence and how common is it for people with prostate cancer and their caregivers? So we define fear of cancer recurrence as the fear, worry, or concern relating to the possibility that cancer will come back or progress. We say or progress for people that have tumors that are not considered solid tumors, tumors that are considered stable, but what we are fearing here is that they might progress or worsen. And so in some cases, it might just be that you're disease, no evidence of disease, and you might be afraid that the cancer comes back, or you're just afraid that your stable cancer worsens. When we ask cancer survivors what they have in terms of needs from the from their oncologist, from their medical team, usually when we ask, fear of cancer recurrence comes as a top unmet need. So it's a need that you have, you'd like some help with this, but your team hasn't been able to help you out with this. So it's common also for cancer survivors to report fear of cancer recurrence. So when we measure it, we find that about one cancer patient out of two reports at least moderate to high levels of this fear. And I'm going to explain what I mean in a couple of slides by high levels of this fear. So think of fear of cancer recurrence as something that exists on a continuum from low sort of occasional fears or maybe no fears at all to something that has become quite preoccupying and takes a lot of space in your life. So I'll talk about that in a couple of slides. Just something to mention here that research has been done to look at what fear of cancer recurrence looks like in family caregivers, usually spouses. And what we find for the spouses and other family caregivers is that they experience just as much fear around your cancer coming back than the patients themselves. So your caregivers might also be experiencing fears that your cancer could come back or worsen. All right, so moving on to next slide. What do we know about fear of cancer recurrence, specifically in men with prostate cancer? So I've looked at the literature. There's quite a bit that's been written on this topic. The first study, fear of cancer recurrence in prostate survivors, comes from the Netherlands, and it found that 36% of the men, of the 200 and some men they surveyed, reported high fear of cancer recurrence. So it's a little lower than the 1 out of 2 that I mentioned in the previous slide. And that's been my experience in the research in general with men with prostate cancer. The percentage of them that will report a high level of fear of cancer recurrence is usually a little lower than what we find across cancer survivors. So if across cancer survivors it's 50%, it's a little less for men with prostate cancer who report high fear of cancer recurrence. However, there are groups that are more vulnerable. So younger men, and this study in those with, all right,
Sorry.
no problem. It's that kind of day. So younger men and those who had radiotherapy had higher levels of fear of cancer recurrence. And this study found that fear of cancer recurrence was especially triggered by medical exams. So you probably have to go to the cancer center or your GP for follow-ups, maybe every few months or every year. And that's usually a time that's particularly challenging in terms of fear of cancer recurrence for some men. And when fear of cancer recurrence was present, it was associated with worse quality of life. So that's the first study. A second study here looked at over 2,000 German cancer survivors. And the reason I chose this one is that it really looked at long-term outcomes. So they looked at men that were 7 years after their radical prostatectomy and found that about 6.5% reported really high levels of fear of cancer recurrence. And then they studied them after that another 9 years later. So now we're talking about 16 years after their initial diagnosis. And that level of really high fear of cancer recurrence did not decrease. It actually increased a little bit. So that's another take-home message. The first take-home message was that the high level of fear of cancer recurrence in men with prostate cancer is probably a little lower than the average that we find across cancer survivors. The second take-home message is that even though it's lower, this is not a concern that will go away on its own over time. So for men that experience high levels of fear of cancer recurrence, this is something that may persist, for 5, 10, or even more years. Okay. And then the last study I mentioned was this morning. I was wondering, what about men who are on active surveillance? Because that's something I know is quite common among men with prostate cancer. And I was wondering how that bunch was doing compared to those that may have more further treatments. And this was a really recent 2021 study of Norwegian men. And they found that those, so they compared men who had received radical prostatectomy and those that were on active surveillance, AS. And these were men that were 4 years after their initial diagnosis. Again, they found about 1/3 had high fear of cancer recurrence. So that number seems quite consistent. And again, fear of cancer recurrence was more common in younger men, specifically those that were under active surveillance. And I'm sure you might have questions or some explanations as to why. I can imagine it must be hard to be just waiting and not necessarily doing something active to manage that. And it was also high in men who had had radical prostatectomy 4 years ago and who had experienced a recurrence as per their PSA levels. Okay, so even though this might not be a huge problem for a majority of men with prostate cancer, there are pockets of men that that are more likely to experience high fear of cancer recurrence. So I keep on talking about high fear of cancer recurrence, and then I thought, well, let me explain what I mean by that. So fear of cancer recurrence, like any emotion we have, varies from normal to what I call clinical or excessive fear. So for me, normal fear amongst the people I work with is somebody that will, around their, let's say, their annual visit to the cancer center or their GP for their annual whatever scans or whatever tests they have, are experiencing for those, a few days before, and while they're waiting for results, they're experiencing some anxiety. But they find that in general, that anxiety is manageable and kind of predictable. On the other hand, is the people that I help with the most in my research studies, it's people that have really excessive fears. And then I'll talk about what that means. But at that point, you're likely thinking about this most days, and it's having a quite significant impact on your life. So who's at risk of experiencing this high level of fear of cancer recurrence? So when it starts becoming a problem and you find it bothersome and you're not quite coping with it the way you'd like. So we know it's younger patients and those that have multiple physical symptoms or side effects. So here I've put the ESAS, so the Imminent Symptoms Assessment Scale. So it's the questionnaire that you probably out at your cancer center every year or every visit. So it asks, Do you have pain? Do you have fatigue? Do you have nausea? Do you have depression? Do you have shortness of breath? What physical symptoms do you have? And in general, the more physical symptoms you have, the more likely you are to experience fear. And we think it's because aches and pains are likely to act as reminders that you have cancer, or sometimes signs of, oh, and you wonder, I wonder if something has gone wrong and the cancer has come back. So the more of those side effects you have, the more likely you are to experience fear of cancer recurrence. A question I get all the time for patients, but also from their medical teams is, well, wouldn't it be the people with the highest risk of recurrence that experience the most fear? So I know that in general, prostate cancer has a good 5-year survival rate, and that there might be, of course, some more advanced cancers that have worse survival rates. And you think, well, maybe it's the people that were diagnosed later that experience more fear of cancer recurrence. That would make sense, but that's actually not the case according to the research. So there is no good relationship between what your actual risk is, what your medical risk according to your team is, and your fear of cancer recurrence. What matters is what you think your own risk is. So what I call your perceived risk. So I've worked with many people who've had, let's say, an 85% chance of being disease-free for the next 5 years. But these people experience very high levels of fear of cancer recurrence because they were convinced, and they would tell me, I know what the doctor has said, but I'm 100% convinced that my cancer is going to come back. So that's what I mean by perceived risk. They knew the stats, they knew what their actual risk was, probably quite low, but they had in their mind a number, and that was their actual risk, and it was much higher. And that was driving their fear of cancer recurrence. So in case you're wondering, well, I do worry from time to time. Am I kind of in a normal range of fear of cancer recurrence? How do I know if my fear of cancer recurrence is excessive? So here's what I look for as a psychologist when I meet with new patients. So I'm going to look for you having thoughts or images or worries. So the what ifs. Well, what if my cancer comes back? Then we can't do this, and this will happen to my family. And you tell me that they're hard to control. You're trying to push these thoughts out of mind, but you're not succeeding, and you find them hard to control. And these thoughts, these images, they're occurring not just during those follow-up visits to the cancer center. They're happening most days outside of your appointments or while you're waiting for test results. So this is something that's present in your life most of the time. And by the way, here I have in the past 3 months. So this is not something that will happen once in a while out of the blue when you find out that one of your friends or coworker, someone you knew has been diagnosed with cancer. This is happening, pretty much every week in your life. And you're also repeatedly concerned that something that's happening in your body, some sort of physical sensation, means that the cancer has come back. So you probably have had moments where, you experience a headache, you've experienced some sort of different aches and pains, or people who are like that, and then they think, oh my gosh, my cancer has come back. So I look for people who are preoccupied like that and think that their body's feeling different means that the cancer has come back. Okay. And last thing I look for is, are you spending too much time on the internet, looking at signs and symptoms and looking for clinical trials and looking for evidence? Are you asking for additional tests? Are you going to see your family physician too often? Are you asking your family, your loved ones around you to reassure you that nothing is going on? So when I mean spending too much time online, I've worked with people who had spent, like, let's say, about 3 hours a day researching stuff online. So you can imagine that that's what I mean by that's a lot. And of course, you find your day-to-day life is impacted. So I remember one young guy I helped. He would no longer go play sports. He was part of a couple of rec leagues. He wouldn't go to those leagues anymore with his buddies because people would ask him, so, how are you doing? And how's life? And how's your health? And every time someone would ask him a question, that made them think about cancer and the thought that the cancers could come back. And it would make him very, very anxious. So at that point, he decided, I'm just no longer going to go to those things because I know people are going to ask me questions. It's going to make me think about things I don't want to think about. So I'm just going to stop that. So that's the kind of people I'm looking for. All right, now getting into the bulk of things in terms of how can you manage your fear, whether you're a caregiver, listening into this talk, or if you yourself are, at times experiencing fear of cancer recurrence. So, what can you do? I think really important, I would say, is kind of normalized. So again, I said it's really common to experience fear of cancer recurrence. Just because you have occasional thoughts about the cancer coming back doesn't mean that there's something wrong with you. It's common and normal for cancer survivors to experience these fears or for caregivers to go through that. I think as much as you can, I'd encourage you to talk about it, to listen. If you're a caregiver and you want to, your spouse is opening up to you. What we notice in terms of partners, and I know many of you are probably turning to your spouses sometimes to have some conversations, is I've worked with many couples where they're both really sweet, well-meaning people, but what happens is that no one wants to worry the other. So the person with cancer doesn't want to talk to their spouse because they're afraid that this is going to worry them. And the spouse who's really concerned about what could happen in the future doesn't want to talk to the person with cancer because they feel they're already carrying enough on their plate. So basically, no one talks about this and it sort of just grows. And then the couple feels like, my gosh, we really can't talk about this. And it's the elephant in the room for them. So, as much as possible, chances are that your spouse would like to talk about this, or your spouse is waiting to find out what you want. So, if possible, if available, try having a conversation and see where that goes. I mean, you hear a lot about self care all the time, and that means probably different things for everyone. So, that's people meditating or doing yoga, but it could be something completely different for you that where you feel like, okay, that's what makes you feel better. So engaging in something that makes you feel better will help during those times where you might be thinking about the cancer coming back. And I really encourage people that I work with to seek appropriate medical information from their team. I've worked with so many people who were afraid to ask questions from their oncologist, who had never asked, about rates of recurrence or relapse or additional treatments or what would happen. They didn't know was in charge of their follow-up. They basically had a lot of unknowns, and this was making things scarier. So I know these are not easy conversations to have, but sometimes it's even about asking, what are the signs and symptoms of recurrence? Is there anything I can do to prevent a recurrence? And I find that people who have good medical information usually manage better than those that avoid that kind of information. For those that maybe, whether it's a caregiver or a patient that think, you know what, I think I need professional help with this. And I know it's not easy to go and ask for professional help. The good news is that there's really good evidence, there's good interventions out there. A licensed psychologist, a social worker, psychotherapist that practices in this area should be able to help you. There's good evidence that something we call CBT or cognitive behavioral therapy works well to help people go through their fears, or something we call mindfulness, also another form of therapy that works well. It could be done one-on-one, it could be done in group, and usually there's good evidence that this could help somebody decrease their levels of concern about the cancer coming back. Another tip I mentioned, so this will not come as a surprise, is letting go of seeking too much reassurance, specifically online. So usually when I work in groups with patients, most people have an inkling that looking at Dr. Google online is not a good idea at some point, right? You open up, you click on something, then you click on something else, and you click on something else, and then sometimes you get into scary stories. So as much as possible, we say, well, use a reasonable amount of, internet searches, stick to the good websites, and be mindful and just ask yourself, is this helpful to me at this point? Many people I work with, on the other hand, try to avoid and block all thoughts of the cancer coming back. And I've actually had many people come to me and say, what I want, Sophie, is for me to learn tricks from you about how to control my mind so that I can just stop thinking about these things. if I could shut down my mind and just not have these thoughts, then I wouldn't have a problem. So in order to do that, I've worked with people who kept themselves very busy. So they tell me, wow, you should look at my agenda. I'm busy from morning to night. The problem, they tell me, is that at nighttime, when I'm lying in bed and I can't do something to distract myself, then that's when some of the thoughts keep coming back. So some people spend too much time really trying to avoid things or push them out of mind. So what can you do instead? So some people talk about acceptance, accepting that the thoughts are there, that there are bad days, that this is your reality. Seeking social support. So you're in a support group today. I'm assuming that this is something that you're doing. You're looking to get support. And then basically just sometimes taking small steps to look at what has cancer meant to you? What has changed? What has your experience been? And just looking inside of your fears. What are you afraid of? And just looking into that and talking about that. So we're going to do for the next 30 seconds an exercise that I call the pink elephant. So the pink elephant is for those people in the room that may be hoping that really, if they try hard, they can really get rid of all those thoughts about the cancer coming back. And that it's a matter of, mind, power of your mind to control these thoughts. So what I'm going to ask you to do in the next 30 seconds, and I'll be sort of counting them down and reminding you, is you're going to close your eyes if you want or leave them open, and you are going to try as much as you can to block any thoughts or images of elephants, pink elephants in particular. Okay? So when I say go, you are pushing those thoughts out of mind for the next 30 seconds. If you do think about a pink elephant, an image pops into mind, you just raise your hand. Okay? So let's see how you do starting now. Block all thoughts of pink elephants. "20 seconds left. Keep those thoughts of elephants away. 10 seconds left. Try harder. All right, your 30 seconds are up. I can't see everyone on the screen, but I'd be really curious to know how many of you managed to push all thoughts of the pink elephants, or if this is what you got instead. You got a ton of pink elephants. Here's a trick from psychology. The more you try to block a thought, the more it creeps up. So if some of you were like, oh my gosh, I'm seeing more and more elephants, the more I think about it, that's exactly what's supposed to happen. So your mind is designed in such a way that if you try to push the thought, it's just like a pressure cooker. You're trying to push something down, and the pressure is just going to make it sort of bubble over. So that's what happens. Occasionally, when I've done this exercise in various groups, people tell me I was able to do it. I was able to block all images and thoughts. I didn't see a single pink elephant. I'm like, awesome. How'd you do that? And they tell me, well, I thought about my cottage or something else, a room or something, a project. And I just went through every single detail. So I, thought about my cottage and I went through every single room. That's the only thing I focused on for 30 seconds. I'm like, was that hard to do? They're like, oh yeah, it was a lot of effort. So you were able to do it for 30 seconds. Well, now imagine doing that for an entire day or an entire week where you are going to try your best to really think about something else and really push all thoughts. Do you think that's sustainable over time? And they're like, no, probably not. I'm like, yeah, that's the point. It would require a lot of efforts and you can't do it long term. So that was that for, trying to, don't try to block the thoughts. It's not going to work. It's going to make things worse. So what can you do instead when you notice that you are having these thoughts? So I would say, remember occasions when you were, where you were able to manage uncertain times. So fear of cancer recurrence is difficult because you don't know the if and the when and the what would happen. But there are probably other times in your life when you manage uncertain times. You probably at some point changed jobs, you graduated from school at some point and launched into that. Maybe you went through your retirement and you had to navigate the uncertainty of what retirement would look like. Perhaps your family circumstances changed. Maybe you moved to a different town, a different province. So you went through difficult, uncertain times and somehow you managed. So this is another way for you to think about, well, what worked for you then might work for you for fear of cancer recurrence. One that I really love is sort of paying attention to how you talk to yourself. So I have a lovely man that I helped with for a number of years now. It's head and neck cancer, but my gosh, when he was feeling some anxiety, he would tell himself something like, "Come on, John, just snap out of it. Just, just, just get rid of this anxiety. You shouldn't feel this way." And he would talk to himself really harshly, and I would ask him, could you do that, but maybe with a bit more kindness to yourself? Like, would you talk to your best friend that way? And of course, they wouldn't talk to their best friends or their wives that way. They would be much more compassionate, but for themselves, it was hard to do. So keep in mind, what would you tell your best friend when you maybe sort of are beating yourself up for not having a great day? Some people find it useful to have sort of a mantra or like a feel good phrase that they repeat to themselves when the going gets tough. So when they're experiencing anxiety, this is one I use myself. I'm doing the best that I can. I'm truly doing the best that I can right now. Others that have told me about, I'll cross that bridge when I get there. Um, no point in worrying about that right now. This thought is not helpful to me, and so on and so forth. So you might come up with your own thing that has helped you in the past. And then I would say, sort of, this is my before last tip, aim for an amount of worry that is just enough. So you don't want to be worrying not enough or too much. So what's a good amount of worry? So a good amount of worry is going to look like something like this, where there might have been times in your life. So think about it as like studying for an exam. Okay. So it may have happened to you where you studied for an exam and you really didn't care about the exam and you really didn't like it and you didn't study. So you'd be here, hopefully you can see my mouse moving. So you were here, you didn't care, you didn't study. So your performance was not very good. You weren't very worried, great, but your performance wasn't good because you were underprepared. So we don't want people to be underprepared when it comes to cancer. That means like not following up with their GP, not, watching what they need to watch for. We want people to be active and engaged and, paying attention. So then that's when your performance started improving, and we reach sort of a peak performance. You're thinking about it, you're thinking about your health, you're doing the things that you need to do, but you're not here on the other hand of the curve where things start sliding down. So there's a point where we know when sometimes your anxiety gets too much and it becomes distracting. It becomes a nuisance more than anything else. So you become so anxious that you can't focus. So I don't know if that's ever happened to any of you in school, but it did happen to me once in my life during a stats exam in my undergrad. I saw the test, I looked at the exam, and I froze. I panicked reading the first exam question. My anxiety was so high that I couldn't focus. Eventually sort of flipped over to the next set of questions, started working. But during that time, my anxiety was distracting, and all I could do to cope was swear in French Canadian, loud French Canadian swear words that were just bothering myself, and everyone around me was trying to take the exam. So you want to be here around sort of, thinking about cancer and doing what you need to do, but not here where the anxiety is too much. The last tip I'll talk about is, I think, one of the most important one is learning to pay attention to what you're saying to yourself, what's going through your mind. It's one of the most powerful tools in psychology. It's called challenging your thinking. So for example, if you on occasion get worried when you experience a physical symptom, so a pain, an ache, or unusual fatigue, and you start thinking, wow, I think the cancer has come back, a way to challenge that thought is to ask yourself, could there be an alternative explanation to this physical symptom? Could a headache sometimes be just a headache and not, evidence of metastases to the brain? The way we do that, we say to yourself, so what's triggering you here? So sometimes it's the headache, but sometimes it could be hearing that your neighbor has been diagnosed with cancer, or it could be going back to the cancer center, or it could be hearing that, so and so in the media got diagnosed with cancer. That triggers you and you start, being worried. So here you have to start asking yourself, what am I thinking? And here the thought is, I'm sure my cancer has metastasized to my brain. And then, depending on what we say to ourselves, we'll start feeling a certain way. So here, the consequences of these thoughts is we might, have symptoms, physical symptoms of anxiety that are represented here. So feeling faint, rapid heartbeat, and so on and so forth. And then I said to you, well, what do you think went on? And then people over time learn, yeah, I think I was catastrophizing. So something happened, and I let my mind go through the worst outcome possible. So what we do in our groups is here's an example of how we help people challenge their thoughts. So I'm going to ask you, well, what was happening? What was the situation here? What was triggering you? Well, my annual physical exam was coming up. And how anxious was this? 90% anxious. And what do you think you said to yourself? I can't do this. If the cancer comes back, I just can't handle this. I'm not strong enough. I can't go through this again. And then we'll say, well, do you have evidence that you can go through this again, or that you're not strong enough? And then, you'll come up with something like, you know what? I've been to many positive medical checkups. There's no evidence so far. I've always managed. And then we help you come up with an alternative, like a more helpful way to think or more realistic response. And it could be something like, I know this might be difficult, but I can do this. I'm not alone. I've got good support. I trust my team. And then we ask you to reevaluate, well, okay, is this helping you to think, to generate a different way of thinking? And most people will be like, you know what? My anxiety comes back when I look at things differently, maybe a bit more rationally, or something. I have thoughts that are more helpful. So those are some examples of some of the tips and tricks, and I'll be happy to take your questions. The last thing we'll talk about is this research study that Janine, my graduate student, is conducting. So this was she'll explain the study, but this is for the caregivers now who may be experiencing this fear. So Janine, I guess you're on, and I'll move the slide after you.
Sounds good. Hi, everyone. So essentially, we're conducting a study, an intervention for female family caregivers. And ultimately, the study would include 7 weeks of group therapy. And during these sessions, the group would have a chance to go through some of the tips and tricks that Sophie has mentioned, and ultimately get a chance to talk to other family caregivers about their experience, about how it is for them, and to talk about their fear of cancer recurrence. So we're looking for family caregivers, and that includes wives, sisters, anyone who identifies as a woman and who is currently taking care of someone who has been diagnosed with cancer. And as I mentioned, they would be small online group meetings, and they would be weekly for 7 weeks. And if you or anyone you know is interested, I'm going to put my email address in the chat, and that would be the best way of reaching me. And thank you for your time and for listening. I appreciate it.
All right, so if there are caregivers here, don't hesitate to ask us questions afterwards. If you think this would be beneficial to any of your adult caregivers, whether it's spouses, sisters, other parents, daughters, please pass along this information. And we did meet last week with the caregiver support group and had a chance to present to them as well. So that was us. We sort of power through this, but I have about 10 minutes for questions. Reach out if there are any from the group. I see there's something in the chat, so I left. And in case we don't get to your question, and I hope we do, but in case we don't, here's my email, slebel@uottawa.ca. This is Janine's email in case anybody has questions for her about the caregiver study. And all right, let's see if there are any questions.
Yeah, if anybody has a question, please feel free to either send it in the chat or if you could raise your hand and then we can call on you to unmute yourself. There's a question that I just received here. Do you advise participants in the caregiver study to prepare for the worst but expect the best?
Actually, one of the things we do is we look at what the worst would be for them. So each person probably fears different things, but often it boils down to, I'm afraid I'm going to die, or I'm afraid my loved one is going to die, even though this may not be the reality right now, at least. But people prepare for the worst, and in our groups they usually have found that helpful, because most people will just think about the worst and they don't want to go there, so they're like, okay, I know I'm afraid of something really scary, but now what we do with them is that eventually we really just gently stay with the worst and prepare for that. So for some people that's meant having difficult conversations, preparing power of attorney, really explaining what they want, having conversations with spouses or children, adult children, writing things, preparing letters for loved ones. So putting their fears in order, like coming up with a plan if you want. And that a lot of people have found helpful, because then they're like, okay, you know what? I've looked at the worst, I'm prepared, I know what I would do, and that sort of lifts a weight off their shoulders. That's a good idea.
There's a comment here. I would suggest that any prostate cancer survivor who is watching his PSA rise and it now exceeds 0.2 is going to have ongoing anxiety issues because of the uncertainty that you're facing. The key is to maintain your attitude at the peak level.
Right. So this is really when we talk about that anxiety. So you want to monitor things. You want to have a conversation with your team about what those numbers mean, what you should do when, I guess, you hit a certain number, who's supposed to help you, what are you supposed to do at that point? And then sort of, okay, if you know that predictably this is going to create some anxiety for you, what is in your toolkit? So today I sort of threw a bunch of little tools at you, but you have a toolkit and you've been accumulating tools probably over the years that you've been living with this cancer. So what is in your toolkit that works for you, where you're like, okay, well, I know that I'm going to be anxious during that time. Is it talking to, to someone in your, in your support system? And this person is really good at keeping you calm, for example, when you know that this is happening. So that would be an example, I think, of a great trigger for most people.
Thank you. Does anybody else have any questions? Oh, here's one. Question for a friend of mine who's dealing with a progressed cancer.
Mm-hmm.
The worry is not that it will come back, but how quickly it will progress and how will I manage the progression?
Right. So again, I find that one's a little tricky because it's hard to know, okay, what are we dealing with? Are we dealing with, a progression and more treatments, and then, perhaps we'll go back to a fairly sort of stable quality of life? Are we dealing with end of life issues? So my first advice would be trying to figure out from your team, what does this mean? So that you're not catastrophizing and going through the worst place when it's not the case, but you're not also avoiding finding out what you need to, to get ready for. So that would be my advice. Sort of having difficult conversations about what it's mean, not jumping to the worst conclusions either. But I think there's lots of things when it does reach a stage where cancer has really progressed and we're looking at later stages. I think there are things that people can do to face that. Some of the tricks I've talked about are helpful to learn to manage anxiety throughout. But I think when it comes to really preparing yourself for the last phase of cancer, I would do things a little differently as a psychologist. But what I find most difficult is when I've had patients who didn't really know. And I'm like, okay, well, am I helping you live with, just the uncertainty? Am I helping you prepare for end of life? you don't know, I don't know. So I think it's possible, let's ask questions so that no one is caught off guard. I see questions and I see somebody has their hand up, so I'm not sure how you want to do that.
Yeah, Roy, do you want to go ahead?
Yeah, I just want to make a comment. I really appreciate the things that you've said, Sophie. And I think a lot of it, how people handle anxiety, because I've had to live with cancer for 16 years. And right now, both my wife and I are going through cancer treatment at the same time since my prostate cancer back in 2005. So, and I feel that the biggest thing is to deal with anxiety is to have confidence in your health team, the doctors that you're dealing with. And if you have that level of respect with them and you can ask them the questions, you make a point of asking the questions, they'll give you the answers to the best of their ability. And just being comfortable with that has been a big tool for me. Mm-hmm. But it is a real challenge when you're both on the same road at the same time for treatment, I'll tell you that.
Oh, I can imagine. I mean, it's already a lot when one member goes through it. We have been wondering what it's like when both members are going through the treatment at the same time, and then you have double the emotions and the sadness and the anxiety and less probably physical resources to deal with all of that at once. So yeah, that must be quite challenging. I do agree with your comments about the medical team. In my experience as a psychologist, the people that I've seen struggle, not all, but some had like bad experiences with their medical team. So if you feel like your medical team dropped the ball at some point, tests were lost or results were incorrect or something happened, you're not happy, you don't click with your team, that can be, in my opinion, something that can make your anxiety worse. Because like you said, you don't trust that your team's got your back, or that you can lean on them and when you need them. So for sure, I think that's an important one.